In this clip, 15-year-old Shakia Austin was brought to the hospital after suffering seizures. Healthcare providers are working on stabilizing the patient's lower extremities, likely preparing her for transport or further treatment. Shakia is receiving assisted ventilation via a manual resuscitator, and she was later intubated as she was taken to a CT scan room. Additional tests revealed Shakia's seizures stemmed from a toxic pregnancy, also known as eclampsia. This condition is characterized by high blood pressure, protein in the urine, and sometimes seizures. If the pregnancy is far enough along for the baby to survive outside the womb, induction of labor or a cesarean section is often performed urgently to prevent further complications. In Shakia's case, the induced delivery likely helped stabilize her condition and saved both her and her child. After several weeks of recovery, both Shakia and her newborn child returned to normal. Shakia later enrolled at a school for gifted students. Exposing Shakia's feet during seizure care could serve several purposes. During seizures, it's essential to prevent injury while also ensuring that medical providers have full access to the patient's body. Feet might be left uncovered if there was a risk of involuntary movements or for easier application of restraints to prevent harm. Seizures and critical medical interventions can cause fluctuations in body temperature. Exposing extremities can help in maintaining an appropriate temperature balance, especially if overheating or cooling is a concern. Estimating Shakia's shoe size from the available clips is possible by comparing the length of her foot to the visible width of the stretcher. Based on average foot sizes for women and her body proportions as observed, a plausible estimate would be U.S. women's size 6 to 8. However, this method relies heavily on assumptions and visual scaling which are not precise.